Edutainment Studios welcomes you to health insurance, knowing your options. This module is part 4 of a 6-part series on health insurance. Health insurance can help you stay healthy by paying for all or part of the medical care you need. However, it is easy to feel overwhelmed with today's health insurance options and requirements. There are more types of health insurances to choose from than ever before. All of these choices, along with new laws created to protect you, make choosing a health insurance plan more confusing than ever. At the same time, the health insurance providers are putting more expectations on you to take greater control of your own health care. In this course, the objective is to help you demonstrate how to choose a health insurance plan and explain how health insurance works. Here are a few tips to assist you in choosing an insurance plan. First, consider how much medical care will be needed, rather than just choosing the plan with the cheapest premium. In most cases, the lower the monthly premium, the higher the out-of-pocket costs will be. Therefore, if frequent visits to the doctor are needed or prescription medications are taken regularly, you can actually save money in the long run by paying a little more each month. Second, it would be beneficial for you to make a list of the benefits that are most important to you and take into consideration your particular needs. For example, do you need to see specific doctors? Do you need to take brand-name prescription medicine? You should look for a plan that covers these benefits. Third, keep your own personal goals in mind. When choosing between plans, you should ask yourself, which plan gives me the best coverage of services I need for the most affordable price? It's a good idea that you check into cost of prescription medications, and if you'll be required to pay a percentage of those costs. If so, you need to understand which medications this applies to, what the percentage is, and what the average cost of the medicine will be. If a medicine costs hundreds or thousands of dollars, paying even 40% of the cost could make it unaffordable. Benefits are defined as healthcare services that an insurance plan will cover in full, or share the cost with you. Now we're going to discuss the 10 essential benefits that most plans will cover. 1. Outpatient care is the most common type of healthcare. You see the doctor because you are sick or hurt, get treatment, and then go home. 2. Preventive services include many vaccines, like the flu shot and hepatitis vaccines, as well as screenings like blood tests for high cholesterol and mammograms to check for breast cancer. Preventive services usually include yearly wellness visits with the doctor. 3. Lab services are diagnostic services or medical services that diagnose, treat, or keep tabs on any condition you may have. 4. Emergency care is when you go to the emergency room because you need treatment right away that cannot be performed in the office. 5. Prescription medications or pharmacy benefits are any medicines that require a doctor's prescription to get them. Most plans will have a formulary or a list of the prescription medicines it covers. Formularies usually divide drugs into different levels called tiers. This means that medicines on different tiers will have different costs. 6. Rehabilitative services assistant in recovery after being hurt or sick. It may help reduce pain or help you walk or talk again. Rehabilitative services helps to manage issues from ongoing illnesses, like physical therapy to help people with multiple sclerosis walk easier, or occupational therapy, which will help with assertive devices to perform the activities of daily living, like getting dressed or using the toilet. 7. Mental health services and treatment for substance use. Disorders include things like seeing a psychologist or counselor to treat anxiety, depression, an eating disorder, or drug or alcohol addiction. 8. Maternity and newborn care includes care for the mother before and after the baby is born, as well as childbirth and care for the newborn. 9. Pediatric care includes most types of preventive and general medical care for children. Under the ACA, most plans must now cover basic dental and eye care for children under the age of 19. 10. Hospitalization includes hospital stays and treatments, like surgery, that are performed at a hospital. Please feel free to investigate these sites and others for more information, and remember to bring any concerns or questions in to discuss with your doctor. Thank you for joining us today for part 4 of 6 of this series on health insurance, and come back for part 5.